Thank you. Today we're speaking about mental health. And obviously, mental health has become a topic of headline concern because of COVID-19. There's a lot of controversy whether COVID-19 has actually brought out more concern about mental health awareness and mental illness, or rather that was always bubbling beneath the surface. And COVID-19 has, in fact, just opened the door to our conversation, resulting from isolation, resulting from anxiety, fear. But let's face it, everyone, mental health or mental illness has long been a topic that has been not discussed enough. What is our system to deal with that? How do we help people? How do we help people from a therapeutic standpoint? How do we help them from an interventional standpoint? How do we help them actually using the tools of innovation and digital health to make them feel more comfortable in engaging a system? And our panelists today are really going to help us explore those topics. For those of you who are on the innovation side, attending from digital health innovation, health technology, health information, you're going to find the insights from today's speakers illuminating. And I want to introduce our panelists to you because they are truly world-class experts. First and foremost, it's my pleasure to introduce Megan Zweig to you. She's the Chief Operating Officer from Rock Health. Rock Health is an organization I have long followed. I hold them in high regard. I recommend everyone go to your social media channels and begin to follow Rock Health. Rock Health is started really as a seed funding organization in the digital health space for really potential game-changing entrepreneurs in the sector. It's evolved into much more, and you're going to hear a bit about that. Rock Health today is also in the consulting area of digital health. It's working with pharmaceutical companies, life science companies, clinical research organizations, academic medical centers, and much more. Megan's going to touch on that. So I would just say that I follow Rock Health for a very specific reason. Their information, their analyses on digital health is among the second to none. So if you're interested in digital health and you're here, I'm assuming you are, please follow Rock Health. Next time, it's my privilege to introduce Susan Fanning. Susan and I have been on panels before, generally focusing on Southeast Asia. She's really a world-class guru. She's an advocate for the patient voice within the system. This is a really critical topic, mental health and patient voice, because too often the system itself is talking around the patient, but not with the patient. Susan has an amazing title. You know, she is really an executive. She's the Chief Health and Wellbeing Officer for Prudential Life Assurance. It is a major company. She's based in Thailand, but Prudential Life Assurance is a global company. I think in Thailand, and Susan will correct me certainly, there's more than 800 employees within the operation, just in that one country alone. Susan really is there to make sure that the people that Prudential Life Assurance represents have a representative at the decision-making table. She's part of the executive team of the organization. Her clout and influence extends beyond Thailand to the entire region and beyond. So she's also going to talk a little bit today about how the organization, how Susan is using digital health actually to better serve their customer base. Later on, we're going to be joined by Dr. Nicki Tessler. Nicki is part of one of the largest behavioral health enterprises in the United States. Universal Health Services, or UHS, is a major force. I think they have something like 400 acute hospitals, behavioral health facilities, and ambulatory care centers. That's something like 100,000 employees, by the way. You can imagine the millions of people that UHS is serving. Now, these are three diverse speakers. They're looking at three different elements of the digital health ecosystem and mental health. But when we listen to them today, we hear the three of them together, you will have a far more complete picture of how to engage this actually growing market. It's sad to say, but it is a growing marketplace. So with that, I'm going to turn it over to our first panelist, Megan Zweig. She's going to share with us actually breaking trending data from Rock Health. Megan, thank you very much. I so appreciate your getting up in California, starting your day with us before 6 o'clock. Thank you.
Yeah, of course. Thank you so much for having me, Gil. The San Francisco morning is just getting started. So if you hear a little bit of street sweepers or trucks in the background, that's just San Francisco saying a little hello. I am coming to you from my living room. I'm in a very cozy and lovely but small San Francisco apartment. So I definitely can't walk into my closet, let alone work in my closet. But that's a good tip for when I hopefully upgrade someday. So again, I'm Megan Zweig. I'm the COO at Rock Health. Been with Rock Health for about 4 years. As Gil mentioned, we are a seed stage venture fund. So we invest in early stage digital health companies based in San Francisco, but right now the team is pretty distributed largely across the US. And in addition to serving the startup side of the market, we also have an advisory services business to consult with and advise the enterprise, what we consider to be the buy side of the market. So working with health systems, biopharma, health plans, et cetera, to inform their digital health strategies and make sure that they have a really deep understanding of emerging technologies, the startup ecosystem, et cetera. So it's very Silicon Valley of us, but that's what we consider to be our flywheel. So being able to tap into the insights of early stage innovation, supporting that through investment, and then using that knowledge to inform how we advise the buy side of the market. And if any folks have any more questions about Rock Health, always happy to be in touch. Today, I wanted to share some recent insights, research from our team on the digital behavioral health market. So we think of digital health as data-driven, software-based solutions that may be paired with services. And within behavioral health, we're really thinking about mental health, substance use disorder, developmental disorders. So it is a pretty broad and inclusive term. And I think one thing I'll note, and I have a bunch of slides. There's a lot of numbers, colors, data here. So happy to share these slides in follow-up. But what really triggered us to go a bit deeper into this space was this rise in funding that we've seen over the past year. So as Gil mentioned, the pandemic creating more demand, certainly, for behavioral health solutions. And we've seen investors really step up and take an interest in these digital behavioral health solutions. Admittedly, this data is not global. This is actually just capturing the US market, but you can see a pretty dramatic rise in the past couple of years in terms of the number of dollars going to these startups, as well as the number of startups that are being funded. That's the kind of dark green line part of the graph. And before I dig into some of the funding numbers, I wanted to just share a couple of reasons why, as investors, we're particularly excited about this space. The first I would say is accessibility. I think that technology can provide an easier on-ramp for a lot of patients that, otherwise may be struggling something that historically has been stigmatized. It can be hard to know where to get help. It can be difficult to even get a diagnosis or know you have a diagnosis. And so the fact that we now have these, powerful computers in our pockets really gives people an easier on-ramp to connect into solutions. And it may be initially having a mindfulness meditation solution, maybe a solution that's focused on anxiety, but there can be some lighter touch options that are going to introduce people and ultimately potentially triage them to more intensive treatment that they may need. So certainly creating broader access to mental health services is something that we really hope technology supports. The second is just the power of the technology itself. I think it's super game changing in terms of changing behavior. I mean, just look to something like Facebook or Instagram or Instacart. I think some of those technologies you might argue are not positively contributing to mental health, but it's hard to argue that these technologies are really changing the way that we live, our habits. And so a lot of the digital health solutions that we're seeing are asking the question of how can we leverage technology for behavior change for good? when you think about not just telemedicine visits and replicating that episodic model, but really thinking of the power of data science, the power of remote monitoring, the power of technology-based nudges, virtual communication. All of that can inform and change behavior for the better. And it's really exciting to see companies putting those technologies to use to offer a higher and more personalized standard of care. So that's exciting for digital health on the whole, and I think specifically for mental health. Third reason we're really excited about this space is there is a supply-demand mismatch in terms of there not being a sufficient number of behavioral health specialists to serve the demand for those services. And I think we're excited. Technology isn't necessarily going to replace the human component, but it's going to be an extension of caregivers. We were actually talking to one of our portfolio companies, Omada, the other day. They do have mental health offerings alongside their chronic disease management solutions. And they said, we need to marry the AI type intelligence, artificial intelligence, alongside human intelligence. So getting smarter on things like, when is a push notification to remind someone to have a healthy breakfast or to take a medication? When is that sufficient to help them stay on course versus when is a personal nudge from a health coach, someone that they have a long-standing relationship with, trust with, really going to make the difference in terms of that person's motivation and ultimate adoption of these healthy habits. So certainly not all about the tech, but the tech really enabling sustained, trusting relationships and long-term behavior change. And all those things that I just talked through, accessibility, the power of technology to change behavior, extending caregivers, were things that were important before COVID. And so I think COVID has just really put a magnifying glass on the extent of these problems that, to Gil's point, they may be growing, and the potential for these solutions to offer a safe intervention, especially when for so long going to the traditional provider setting was either unsafe or unavailable because of stay-at-home orders and because of COVID. So I want to share some of the insights that we learned going through some of this recent funding data. We've been gathering funding data since 2011, again, on the US-based digital health startup space. And so a few trends that I'll go through relatively quickly. We do see investors supporting both early and late stage innovation. So an increasing portion of that is moving towards these more mature, later stage companies. Certainly won't go through every number on these slides, but just wanted to share that, a large portion of the money that's going towards behavioral health is towards later stage deals. That's what you would expect. Those deals are larger. It makes sense they're going to consume a large portion of the dollars. You've seen companies like Lyra Health, Happify, all raising pretty large rounds over the past few months. We think that trend's going to continue. But I think there's also a really healthy portion of early stage deals. So what that tells us is that investors both believe that these companies are going to mature, they've found their product market fit, they have a healthy exit path, and they also believe that there's still innovation coming down the pipe that's worthy of their investment dollars. And I just say that while this slide is essentially showing the average deal size for early stage deals, which are the green bars, versus late stage deals, which are the blue bars. And I think what's interesting is those green bars have stayed relatively consistent, or not seeing a huge spike in the amount of dollars going to early stage funding. Where we're really seeing that spike is among the later stage companies that are garnering a lot more capital as of late. Second trend that I wanted to dig into a bit more is there's room for both generalist and specialist models, and I'll tell you what I mean by that, to meet the high and diverse demand that we see for behavioral health. So we put, and I will say we didn't choose these companies because they're our favorite or anything like that. We made this list purely based on funds raised. So some of these companies are in our portfolio, most of them are not. But the generalist companies are those that are pairing behavioral health alongside care for other conditions. So, an Amwell, an Omada, a Livongo, you've probably heard these names. They're oftentimes offering traditional telemedicine or chronic disease management solutions, and doing so for a broad range of primary care in the case of Amwell, or in the case of Omada, Livongo, starting with a particular subset like diabetes and then expanding into MSK, other chronic conditions, and pairing that with mental health solutions. As I said, I think, mental health solutions are incredibly powerful for changing behaviors. Behaviors are at the center of all of these chronic conditions. And so it makes sense that you'd want to take a holistic approach, and that maybe someone who has diabetes is looking to shift behavior. A lot of times there's comorbidities related to mental health. So if you can break through, whether it's anxiety, whether it's depression, that's actually going to have kind of a rising tide lifts all boats effect on the other conditions that that person might be managing. So generalist companies offering mental health solutions plus treating other conditions. The specialist companies are those that are exclusively focused on behavioral health. So whether that's mental health, substance use disorder, or a developmental disorder. And I think our point is to say that there's funding going to both of these types of companies. And we think that's really, really important. I think, some folks have said, is there a model that's better than another? And I think we need both. It's almost like thinking about our, kind of health system generalist model versus going to a specialist. I think it's really important that there are some digital health companies that are really specialized in a particular condition, in serving a particular population. We've seen solutions pop up, for instance, mental health solutions for pediatric space, mental health solution for pediatric eating disorders, mental health solutions for people of color or Black women who just gave birth. I think the more that these solutions can be tailored to inflect outcomes for specific populations with particular needs, super important. But I also think the generalist approach is really important too, because I think when you're serving a diverse set of people with different chronic conditions, critically important to consider the role that mental health plays in shifting behaviors that, again, are going to support the broad health of that particular person. So we're not saying, investors are more excited about specialist models or generalist models. I think there's room for both in this market. We're seeing consolidation speed up. So won't belabor this point, but certainly seeing some mergers and acquisitions. I'll largely leave this slide for your later review. But you can see, you have companies like Ginger and Live Better, both mental health companies, teaming up to expand their services and scope. You have companies that, historically, Omada actually acquired the assets of a mental health company that had actually gone under, but they were able to take that evidence-based content and integrate that into their model. So I think we'll continue to see that as some of these platform generalist solutions are looking to add mental health to their repertoire, definitely expect to see some consolidation in that space. And then the final point I wanted to make was we looked at the flow of capital by different segment of behavioral health. So we looked at general mental health, which admittedly is a bit broader. So it's going to include everything from anxiety to major depressive disorder. We compared that to the funding flowing to developmental disorders and substance use disorders. There is generally a lower incidence of substance use disorder and developmental disorders compared to that broader category of mental health. So as you might expect, and what's shown on this slide is that most of the capital is flowing to mental health companies. But I think, again, we see a lot of costs and need associated with addiction, as well as with developmental disorders. And so as investors ourselves, those are spaces that we've been excited about, we've invested in. And I will kind of wrap up what I'm sharing with one of those examples of a company that we've invested in called Marigold, which is in the substance use disorder space. I think they're a really good example of what I mean by technology being used to extend but not replace the care team. So final anecdote is Marigold is for patients who have an addiction, who have been discharged from an inpatient facility or an outpatient facility. Their care manager gives them the Marigold application. Within that app, they actually can be in an anonymous group chat with other people that have substance use disorder to have some social support. What's really smart about the Marigold model is that they then use a machine learning algorithm to understand the sentiment of that chat. So if there's, suicidal ideation, if someone's talking about how they're having a rough day, that sort of thing is going to be flagged and alerted to the care manager. So the care manager isn't monitoring this chat all the time. That's the power of this technology, is to flag when something might be going sideways. And before this person has a relapse, it can help them intervene as the care manager to get that person the support that they may need in that moment. So again, it's allowing the care manager to monitor a broader portion of patients after they've been discharged to reduce some of those really high relapse recidivism rates that we especially see among that group. So again, not a replacement, but just a way to kind of scale the support and oversight of those care managers. So really interesting solution, and kind of the purpose of this final data cut that we did was just to say a lot of potential in the developmental disorder, substance use disorder space, even though we're seeing most of the capital right now going to kind of more traditional mental health companies.
Megan, this is great material. I also want to congratulate you. I don't know if our audience knows that today you released much of this data to STAT, and of course it's getting a lot of attention nationally in the United States because of that distribution. Fortunately, you've also shared a lot of this information with Levy. I want to point our attendees to that as well. And I have to say, I want to also acknowledge you and the data for talking about how mental health is moving into population health. This is great. I hope we have time at the end to ask you more questions on that. With that, I want to invite, if it's all right with you, our next panelist, Susan Fanning, to step forward and to share insights. As I mentioned earlier in introduction, Susan is the voice of the patient for Prudential Life Assurance. She has been dedicated to digital health innovation in Asia for quite some time. Levy shared on the link up some background information about Susan's work previously from a previous mHealth Israel presentation. So Susan, I know you've been really pioneering the work. You're going to, in a way, show where Megan's insights are now being applied inside a major corporation. Thank you.
No, thank you so much. And it's a pleasure to be here today. As Gilles has said, my name is Susan Fanning, and I'm the Chief Health and Wellbeing Officer for Prudential in Thailand. So Prudential is evolving because there isn't an alternative if you want to be successful. And the launch of Pulse is an important part of that. It's part of a cultural shift in the organization, and COVID has been a huge part of accelerating that change. Our purpose is to help people get the best out of everyone's life. We're a 170-year-old insurance company, and in Thailand, we've been here for 25 years. We aspire to be young, authentic, and connected. And our focus is on how do we get people to be the healthiest and wealthiest in everything they do. If we can provide the tools and expertise, we can help people to get the most out of their lives. Is somebody able to help me share the slides?
Susan, would you like to control your slides? You do have co-host ability, or Levy could jump on and take care of that.
If Levy can jump on and take care, would be fantastic. Thank
Wonderful, you. Wonderful. Levy, you have the slides. Would you be willing to do that?
Sure. So Susan, as you just tell me, turn the slide and we shall do that. Okay?
Amazing. Thank you.
Good.
Levy will call those up in a second, and we will be illuminated.
Yes.
Thank you.
There we go. Thank you, Levy.
Well, that's the old one, huh?
You're getting a chance to see Levy's desktop, everybody. This is a rare privilege.
Okay. Let's take about, Susan, if you can just keep presenting for maybe a minute, and I'll pull up the other deck, okay?
Perfect, thank you. So Pulse is a health ecosystem. It's a huge dynamic platform. For us, our consumers are already thinking of wellness and not health. We give people the tools that help them manage their health in a way that helps them prevent and postpone the onset of disease. And as they grow in needs, we need to grow the services and capabilities that we have, all in one app, which we call a super app. The key USP is true scalable AI-powered health assessment and symptom checker, providing convenience for users to use the service anytime, anywhere. Every time you use it, it gets smarter and starts to recognize you. Our hope is this leads to earlier detection of disease as well as condition management. We know that parents are worried about their kids, and for us, it's about giving them the assurance and helping make people calmer when they're dealing with situations when their family is at risk. The app motivates people with constant reminders to move and to check themselves if they're free, if they're sick, and all of this is free. So if we can go to slide 2. We work with partners to help bring our purpose to life, and all of our partners work collaboratively together to deliver value-add services to keep people healthy. One of the main reasons that families fall below the poverty line is because of an unforeseen and an uninsured event. And Pulse is central to effectively addressing the 3 main reasons why people don't insure themselves, which is awareness, availability, and ultimately it's trust. We give people all the tools they need on a personalized basis, and it's free. We aim to be there at a moment of real need. If we move to the next slide. Pulse has been rapidly evolving. We first launched it in Malaysia in 2019, and since then it's been launched in 15 countries and is available in 11 languages. And this is evolving all the time with more rollouts in countries and languages. If we move to the next slide. In Thailand, we launched Pulse in June 2020, and since then we've had 1.9 million downloads. We have about 80,000 monthly active users, and we're constantly gaining insights into Thai people. Poor mental health is a big part of what we see, with about 50% of users having alarming mood levels and 30% with unhealthy stress levels. Linked to this, we see concerning levels of alcohol intake with double the regional average level of alcohol consumption. Poor nutrition and exercise are other key insights we've gained. Depending on how we define mental health, up to 1 in 4 people will suffer from poor mental health, with the spectrum ranging from stress to paranoid schizophrenic. The line between physical and mental health is all intertwined and dates back to when we had a limited understanding of mental health. A proper treatment plan should include mental and physical health. As Megan said, diagnosis is not easy. The treatment of mental health can go from drugs and talking therapy, CBT, counseling, and increasingly common is psychotherapy to help people through an episode. As an insurance company, we don't deal much with the severe end of the mental health spectrum, but we see a lot at the lower end of the spectrum, which is depression and anxiety. Talking therapy is the treatment of choice now, and if we have a consent from the person, we see it's really important to include families as they know much more about what's happening. We use technology and data to be able to understand signs of disengagement, anxiety, impulse control, and changes in mood. We use it to make sense of what's a complicated mess. And because of the data collected, it makes it easier to be able to digest this mess and make sense of it, and help the individual make sense of what's happening and how they're feeling. Evidence shows that most declines in physical and mental capacity across the life spectrum are not directly related to chronological age, but more due to environmental and lifestyle factors such as diet, exercise, smoking and alcohol consumption, stressful work environments, and psychosocial factors. However, there are some age-related changes to well-being, and older people are more likely to have long-term exposure to relevant lifestyle factors, meaning there's a higher risk of chronic health problems amongst older people than their younger counterparts. Mental and physical health are closely related. Physical illness increases the risk of mental health problems. And we know that people with 2 or more long-term physical conditions are 7 times more likely to have depression than those without. Conversely, mental health problems also increase the risk of physical illness. For instance, depression increases the risk of mortality by 50% and doubles the risk of coronary heart disease in adults. And coronary heart disease is the #1 killer in Thailand. This means that efficiencies and savings can be found by investing in well-being interventions at the physical and mental health interfaces. If we can go to the next slide. Meeting the mental health needs of people with physical conditions through early treatment of mental illness and targeted well-being interventions can both reduce the impact of and prevent development of mental illness in these high-risk groups. A range of interventions to promote physical health and reduce health-related risk behavior can prevent subsequent physical illness and can also improve mental well-being, thereby reducing associated costs. Such interventions are more effective if they're introduced early. Emotional fitness, or its lack thereof, really affects so many different aspects of a person's life, and it's associated with serious physical, social, emotional, and financial consequences. When an individual with emotional issues is diagnosed with other physical conditions, it's also associated with less compliance with physician instructions and prescriptions. Further, people struggling with emotional fitness present with issues such as impulse control and stress, so financial burdens can increase. The combination of stigma, misunderstandings of what treatment is available, access issues, cost of treatment leads to people not seeking help that can alleviate their symptoms early before they turn into larger health problems. Mental health is viewed as a weakness in today's culture. We're unable to openly discuss struggles or support to a struggling friend, family member, or colleague. Often users are overwhelmed and don't understand the difference between the types of services being offered. There's a long wait time for appointments. Providers are underfunded when it comes to mental health, and sometimes there's a fear that the treatment will actually make the symptoms worse. With 25% of depressed individuals reporting fear the treatment will make their symptoms worse. We believe that having tech-enabled remote care spaces will be really important for the treatment and care for people with mental health issues, both today and in the future. And this can include everything from expressing gratitude, music and dance therapy, meditation, but also by offering financial education, resilience training, teleconsultation, online CBT, and life stages counseling. 2 areas for us that have been lacking are mental health and female health, and we're addressing and tackling both of these. I think something's happened to the slides.
Excuse me, I'm sorry about that.
That's okay.
I'll go right back to it. Ready?
Okay. For us to be able to effectively address the mental health of our customers, we need to start from within and tackle mental health for our employees. So we do this by raising awareness. So we celebrated our first ever group-wide World Mental Health Day at the end of 2020, in line with the WHO, to highlight it as a globally focused topic that we're addressing and that we're committed to doing more. We provide preventative care by enhancing and introducing a global EAP program, which we did earlier this year, to cover employees across the group with 24/7 counseling services through conventional hotlines and instant chats with various wellbeing references for lifestyle events. We've included mental health as part of local medical benefits. We launched that here in Thailand in March for all of our colleagues and for their families. We're also providing ongoing engagement or education, which is being promoted through monthly topics and talks on mental health. And we follow a 4 stages approach, which is awareness, seeking help, diagnosis, and actions and practices. If we go to the next slide, we want to be able to bring our brand to a younger audience, and Pulse is doing this because the majority of our users of Pulse are under the age of 35. We've just launched a big partnership with a K-pop band called Super M. So they're known as the Avengers of K-pop. And you can ask, why is an insurer partnering with a K-pop band? And it's all about finding fun and engaging ways to make people discover wellness. And what better way than the world of dance, music, and K-pop? We dance for happiness, both physically and mentally. So what we also know is that dancing enhances neural connections that control focus and attention. It helps promote neuroplasticity due to the integration of several functions of the brain, such as movement, thought, rhythm, and emotions. Last month, we launched a dance community in Pulse, and we're encouraging people to take part in a dance class once a week to support their brain and cognitive health. And we also have amazing benefits that people can get, like tickets to a virtual Super M concert, which will be held in the summertime. But, just thank you so much, Levy and Jill, for asking me to be part of this amazing panel.
Susan, we're very appreciative to you. I think that often what happens is that people get very monolithic in their thinking, and they don't realize that if we're committed to people's well-being and their health, we're committed to people of different regions and often from different backgrounds. And I think that you're sharing this with us is hopefully illuminating people's perspectives and expanding their horizons of what is possible. So we will have time. We're going to extend this conversation. I hope people don't mind another bit, because we really want to hear from Dr. Tessler. I'm going to introduce you again now, Nicki, because you missed because you were attending an important board meeting for the organization. I just want you to know that you were honored, and it's a privilege to have you. You're obviously a PsyD, which is very important to note. Other than a PhD, you are certainly a doctor of psychology. Your emphasis has been on the practical aspect of mobilizing around people's care. PsyDs it's a very prestigious degree. Many people in the PhD field go into the research side, where PsyDs really go into the analytic or behavioral health side of working with patients. Obviously, in her role with Universal Health Services, Dr. Tessler is an advocate for the discipline inside one of the largest organizations that's charged with people's health and well-being. Obviously, an organization that has some 400 acute care hospitals, behavioral health centers, and ambulatory care centers. So it's really a colossal organization with some 100,000 employees. Now, not all the people that are going through the system are dealing specifically with mental health issues. However, whether it's someone's having a hip replacement or open heart surgery and is going through rehab, there is a mental health adjustment that goes on with that. And so mental health touches almost every aspect of health. Dr. Tessler is really one of the key figures inside this large health organization that is dealing with behavioral health. It's a pleasure to have you today. Thank you for breaking away from your busy day to join us. At the end of your presentation, we're just going to continue for a bit with some panel conversation that is recorded, and then Levy Shapiro shares that out as a recording to the entire digital health global community. Dr. Tessler, thank you very much. I know you're controlling your own slides.
Sorry, yes, let me share the screen. Thank you for that warm introduction.
Well earned, well earned. Thank you for joining us.
I very much appreciate it. And I very much appreciate Susan. I jumped on as you're talking, and you just did a tremendous presentation. So really, I feel so blessed to be in the company of everybody on the call, as well as with Megan and Susan. So I'm in great company. So thank you for that introduction. Very kind of you. So let's talk about future-proofing behavioral health care. So, for me, the most important thing to say is that behavioral health doesn't work if it's transactional. It needs to be transformational. And there's a big difference between that. So I sit in a huge structure. And whether you're in startups or you're in a mid-size, or you're a direct-to-consumer, more a family, a patient, it doesn't matter the many stakeholders, whether you're an investor or you're somebody that's impacted 4 degrees from you. The idea here is that we come together in partnership. I start with behavioral health needs innovation, but what I mean is it deserves it. And there's a key difference between the two. We can't sit in these rigid treatment paradigms anymore. That behavioral health for long has sat in behavioral health contexts. We really need to look at behavioral health and say this worthwhile population needs to expand, and we need to start to think in more flexible structures. And honestly, it comes down to partnerships, collaborations. No matter how big universal health services is, it isn't about just us. It's about a community. It's about egalitarianism. It's about collaboration. And it's going to take all of us if we truly want to transform behavioral health and finally, and I mean finally, get on even footing with the rest of these medical fields. I think we've been laggards in a lot of ways. And I can't say enough, and I'm pretty bullish about it, that this is our time to really catapult where we deserve to be and where this population deserves for us to advocate it being. So first and foremost, let's talk about some important areas. Improving clinical outcomes will always be number one to me. We need to raise the quality of care. Specialty tools, things that allow us to tailor patients' diagnoses. That's critical going forward. We also need to talk about integrated care. All of us know how woefully fragmented it is right now. You've got psychiatrists talking to PCPs, and there's poor communication at times. You have separate insurance claims. You have data systems and even new technology solutions that are conflicting, frankly, with the workflows. We need to look at things from an ecosystem thinking so that there aren't standalone offerings anymore. There are collaborative and co-creations and co-developments going on to really go after this field in a meaningful way. And the other point is the empathic understanding of this field. There's a lot of people that get into innovation from a finance perspective, and it's definitely I love that behavioral health is sexy right now. I've always wanted it to be, but it cannot be just from a financial mindscape. You've got to know what you're disrupting. You've got to understand what you're disrupting. And most importantly, you have to have empathy for what you are disrupting. Activating digital solutions can be many things. When you think of what we want to get to, the ideal is establishing a seamless patient journey. And that means developing a shared clinical database, for example, where you've got prescribers and providers and patients and families all working together to really bring and thread a patient's experience. Experience innovation in this field is really important. We need to bring humanity back to healthcare. We also need to engage patients on their own terms. We need to meet patients where they're comfortable with us meeting them. There's 50% of the population that needs behavioral health services that never even comes to any type of context that would help them. Well, those new patients deserve for us to figure out where do we directly meet them? Where do we tailor for their needs? Also, looking at patients as if they're members of the community. And again, like I said before, rather than looking like a provider like ours with a brick and mortar system. But
1 second, please, Nicki. Levy, would you please put Rafi on mute? Thank you very much. I apologize, Nicki. Thank you very much.
Problem.
Please continue.
No problem. So patients as members of the community, meaning that we're not going to just be incentivized by these brick and mortars like inpatient, always higher levels of a containment. Let's go after the lower intensity evidence-based treatments. Let's look at things that don't just look at therapy and medication and digitizing or using digital health that way, but actually going after, stepped approaches to treatment depending on where people are in need. And that requires things like even tech-enabled health coaches. They're an important example to this equation that we need to think more about and incorporate more. So what UHS decided to do was look at, well, how do we make this happen? We're a large behemoth, and we want to also make sure that we're advancing with the times. And so what I did was I founded the Innovation Hub in UHS about 1.5 years ago. And 3 things really compose the Innovation Hub. We thought about the ecosystem desirability. This is as much about us bringing innovation and illuminating it as it is about ecosystems and partnerships and collaborations, which is where all of you come in. That is the key, and that is critical. I can't say that enough. Business model viability. People ask me all the time what I think about certain innovations. You've got to marry the care delivery innovation with the financial model. There's got to be incentive, has got to be a part of how and you design also the care. We want care delivery iterating more and more. We want those innovations, but we need sustainability, which is where the financial innovation, payment innovations come in. And technical feasibility, obviously, is a key component here. And so right now, our innovation hub sits inside the building. It was built with the inside out so that we had a governing coalition and a corporate budget and everything in terms of a portal, et cetera, to make sure that we could have a vehicle for which we could drive innovation and innovative solutions. What our Innovation Hub 2.0 is being proposed will do is actually go outside the bounds. And that's where everybody here comes in, right? An open innovation channel that looks and resembles more of a venture studio. The ideal, as far as I'm concerned, is that we need to figure out ways where we take and expand behavioral health. I see it as a catering business, like a restaurant problem, where we're projecting behavioral health expertise everywhere. Every nook and cranny in the medical fields for sure, but even outside of that, there is a need to look at mental health and to have that type of flexible, agile mindset. And that's precisely what we've set out to do through the hub. And what we thought about from a provider standpoint and a large provider standpoint is that we've got a lot of assets. I've got relationships to leverage. I have operational know-how to harness. And also we have an ambidextrous team and skill set, including with our partners. Imagine the collision of our behavioral healthcare enthusiasts that sit with me and the entrepreneurials that sit in this audience, and the beauty and magic that happens. That is the secret sauce, I would say, in what we're talking about. And also how we bring 2 worlds together, even within UHS, and that's more internal. And what I mean by that is a large company, in order to really execute corporate innovation, is got to figure out a way where we're optimizing our existing business model, but we're also nurturing that future far off, and that we're taking our large size so we can do scalability, which is critical in what we're trying to do. But we're also carving out or demarcating space within the Innovation Hub so that we can finally have speed. We need speed. We're outplayed, we're outpaced as a large provider, and we want to be in the game. And that requires us to have a space that actually resembles more of a venture capital or private equity environment than what we're typically accustomed to. I think also socializing within the company. I've got fantastic sponsorship right now at UHS. We have a great operational tracking record and a pipeline of companies that are interesting in their own right that we're going after. And so figuring out this type of community and build so that we secure the future is what we're looking for. So at the end of the day, we're walking and we're chewing gum at the same time. We also need to make sure that the capital, the human capital is there. Best of breed talent is needed. And we're well aware that we need a very rich and diverse set so that not only do we have the human talent, but that we're aligning incentives accordingly so that personal rewards that people receive in other environments outside of providers can now be brought in so that we're bringing in that type of hustle and mindset that entrepreneurs have so that we all win at the end of the day. Because again, this isn't about me or you. This is about a field that is so much greater than us that we're so lucky to serve. The three dimensions that I always go back to with my innovation hub is as follows. The first is creating a portfolio where we actually move the needle of the behavioral health industry. That's critical. The second is investing not just in ideas, but in outcomes. We're very bullish about rapid experimentation and making sure we prove market fit. So oftentimes you'll see us beta test, determine the viability. We use valuation calculators for that so that we then say, okay, this is vetted and ready to be scaled. UHS very much functions like a sandbox or a test bed, but we need to make sure we actually have the outcomes to move forward. And then lastly, that system of governance. I referred to our governing coalition earlier. That's critical because if we're going to maximize the ROI portfolio, we've got to make sure we've got a system in place that goes beyond just a structure of a hub, but an actual system that allows that to occur. So you go from a level of interest and you actually achieve the execution, which at the end of the day is what it all is about. So in summary, these are the five kind of takeaways. We're going to accelerate the existing innovation we currently have, which requires us to move and transition from inside out innovation to outside in innovation. Second, we're expanding into new domains. As I talked about, this is not just brick and mortar. This is about the end-to-end care continuum that is so critical for behavioral health. For somebody like us, obviously there's gaps to be bridged so that we're really doing high touch and low touch. And we recognize how things like precision medicine, going direct to consumer, all the things that typical corporate providers have not been doing are now very much a part of our game plan and strategic initiatives going forward. The talent. My fantasy is to bring together entrepreneurs and behavioral health knowledge workers all day, every day, if I could. The idea of us really coming together is as sweet as it gets, as far as I'm concerned. The ROI is always a part of this, right? Which is why I talk about business model viability, which is why I talk about maximizing the ROI in the innovation portfolio. We've got to make sure finance lines up with the care innovation. And then finally, we want to shine as an innovation powerhouse. We recognize that corporate innovation and where corporate providers are today needs that sense of urgency and needs to make sure we're doing everything we can to complement and offset our brick and mortar structure. And
Nicki,
so,
please,
end. Yes.
Please.
Oh, sorry. So I'll end with this and at the end of the day, every day I think to myself, what have I done for a patient today? And that's where this comes from. And that's where it starts. That's where it ends. And so for all of us, always keep in touch and keep patients at the center of everything we do. There are times you see patient being lost in perspective. And I think just like every other service line, you win when you really see patients as first and foremost to absolutely, and I mean absolutely, everything you do. Thank you very much for your time.
Nicki, Dr. Tessler, thank you very much for that presentation. I know that you were jumping in during this webinar, but actually, what a wonderful compliment to Megan and Susan's presentations. We want to spend a little bit of time in conversation. This is an hour-long webinar, but we're going to go a few moments longer so that people can hear from you off presentation comment. And I want to ask the three of you a very important question. Obviously, people will access your presentations. I encourage everyone to download the presentations and review them as a complete set, because they really are almost a book about the sector, the evolution of the sector, the urgency for the sector to evolve. So I want to start with one broad question to the three of you. I'm going to start with Megan, go to Susan, and then Nicki to you. And when you look at the combination between mental health as part of health, for some reason, we don't look at mental health like we would look at diabetes or heart disease or cancer. And yet mental health is as critical to people's well-being, their medical well-being, as any other element of health. When we look at non-communicable diseases, for instance, or the 6 major causes of death around the world, people forget. They think of heart disease, they think of diabetes, they think of cancer, they think of respiratory disease. Oh, by the way, number 6, when you get to it, is mental illness. So we often don't look at mental health as a non-communicable disease killer that kills about 70% of people around the world in general. So I want to start with a broad question, but ask for you to drill down specifically. If there were 2 or 3 sentences regarding the mental health sector, whether it's investment, whether why it is worthy of people's attention or requires their attention, or the challenge of stigma around mental health, what would be the 2 or 3 sentences you would want to leave people hearing this recording, attending today, to remember from your perspective? Megan, you're charged with making large-scale seed investment consulting decisions for both startups and major pharmaceutical companies in the mental health field. When you say mental health, focus on it, what are the 2 or 3 sentences from the Rock Health perspective you think people need to remember?
I would say what's exciting is a lot of evidence-based solutions exist. I think what technology is supporting is the accessibility of those care pathways, the affordability of them, and also the personalization of them, so that they're actually programs that patients engage with and sustain and really do change their behavior over time. Obviously, there is a lot of innovation when it comes to new diagnostics, new treatments, but there's actually a lot that we already know about how to support people. And I'm hoping that these digital solutions are kind of helping increase the reach of what we already know to work.
Thank you, Megan. I'm going to flip over to Susan now, but I'm going to take something you said, and Susan, I hope you don't mind. I'm going to just add it to the mix of my question, the 2 or 3 sentences. You are a champion for digital health solutions. No, you clearly from your presentation, you're not just a champion, you're organizing to it and pushing it. When you take a look at people's well-being and their longevity, because obviously Prudential Life Assurance is consumed with people living longer, that's a better investment than to short-term survival. Why do you think people should be focusing on digital health solutions in the mental health sector?
So firstly, there's no health without mental health. It's critical to everything that we talk about. And I think there's a fallacy that insurance companies have historically not paid for mental health and for the benefits that are there. I think there's a difference between whether they've paid for counseling and whether they've paid for other forms of interventions and treatment when somebody is deep in a mental health episode. But they've been paying for it for a long time, in the same ways they've been paying for diabetes and every other chronic condition that exists. So for us, it's about getting upfront. It's about really how do we engage people in their lives at a time and a moment when they start to experience a little bit of anxiety, a bit of stress, and how can we get them involved in a conversation about what do they do about that?
Thank you, Susan. So, no, Nicki, you've just heard from your 2 fellow panelists. You have really brought together unintentionally 2 presentations into your presentation. The economic viability, the technical viability, the fact that it is in the system's best interest to innovate in the mental health area. So I just want to ask you a variation of the question that I asked Megan and Susan now, and direct it toward you. Your enterprise, I mean, Universal Health System Services is to some extent, because you have behavioral health centers, you're also in the business of mental health. It is an economic line of care within the organization. But yet you're kind of responsible for population health management within that as well. How do you track people's mental health? How do you get them better? When you're looking at digital health as part of that equation, what are some of the 2 or 3 factors you consider as a mental health professional, as a PsyD, and what would you want our audience and the listeners to take away from your presentation today? If you were to say, hey, 3 sentences, you got to remember this, everybody. Here are my 3 sentences. Keep it in mind. What would you want to share?
That we need to bring humanity back to behavioral health care. And how we do that is understanding that the reactive paradigm from which we've resided, it does not work, that we need to have a proactive paradigm. And how we'll get there is through empathy and being honest about shame and the stigma that you're talking about. That's how we'll get there. It's not a financial answer. It's the underbelly of the finances, which is the idea of what is care at the end of the day. We've got to bring humanity back to behavioral health care.
Such a critical point. You said something, and our other speakers have spoken about that. I want to bring it up because I think it's such a critical part. There's a lot of self-shame for people who are dealing with mental health challenges, and it's not just the person who's struggling. It's actually their network. And I want to deal with a question on top of a question. So some people believe that COVID-19 has unleashed a pandemic of mental illness. Other people believe that actually mental health challenges or mental illness were always there. What we're seeing now is permission to come forward and say, I'm struggling. So I want to deal from the investment standpoint, from the in essence, the insurance standpoint or assurance standpoint, and the system standpoint. What is changing in this window in terms of the perspective? And I want to start with Megan again, because Rock Health really looks at this from the financial, in a way, as an investment group, return on investment. Is mental health becoming a good investment for industry, for the pharmaceutical industry, in a different way for the behavioral health industry, for the digital health industry? Not because there's more patients or more disease or illness, but all of a sudden people are being given permission to come forward and say, I need that help. Is it one or the other? Is it a combination? Megan, what's your perspective?
Yeah, it's really hard to know if it's one or the other. I think incident rates have certainly gone up over the past year, and that's been reported, but it's hard to know if that's just because more people are coming forward for help, and so there's more diagnoses, or if there are new cases, and that's what's contributing. So definitely hard to say, but I think we're seeing interest across the board from enterprise players. So whether it's health plans, as we've talked about, whether it's in the case of the US, self-insured employers who are interested in providing their employees with solutions to kind of remain well or manage some of these issues, ultimately be productive, safe, healthy, happy at work, as well as health systems. And I think some of that is because of the supply strain, that there is this notice that people are noticing that if you need behavioral health support, oftentimes you're waiting weeks, if not months, to see someone to connect with you. And so it's interesting not just to see the emergence of solutions, but also of solutions that help with navigation. Like there are a lot of different options now. There's a lot of different apps that manage different.
Hold that thought for a second, and I'm going to swing over to Susan, taking what you've said. And Susan, your organization is to some extent ultimately responsible for writing checks and covering care. First of all, are you seeing a trend of more access of assurance, of insurance? That's one aspect of this, but also in terms of what Megan's just shared and what Nicki shared earlier, what do you see that's different than a year ago?
Yeah. So if I just start with, there was a survey that was done in Thailand recently, and it asked about the problems that have increased during the pandemic. And through that, what it had was that 67% increase in depressive disorder and stress, 36% increase in quarrels and disagreement, 30% more divorces and separations. But on the positive side, it's got 70% of people saying that COVID has made them more mindful of the way that they live their lives, with 75% of them saying that they take better care of their health. So what we've seen across Asia and specifically here in Thailand is that the life assurance market has had decline, but the health part of the market has been growing. That people are much more engaged in their health and therefore buying health insurance. Thailand has universal healthcare, so everybody in Thailand can access free healthcare, and it's a good quality. But what we see is that there is disparity in access. So that if you're in Bangkok, if you're in some of the main cities, there's a lot of great hospitals. But outside of that, there's very poor access to care. One of the kind of first and most successful of the health tech startups in Thailand is a company called Oka, and they're a mental health startup. So they were one of the first health tech startups off the ranks, and it's so interesting that their focus was on mental health.
Megan rather is probably right now online looking them up and seeing if that's an investment possibility. So, these collaborations work strongly. So thank you for that. It's good to get the data. It's a separate conversation on the benefits of access to care. Does access to care actually produce over the long haul better results for public payers? By engaging early and getting people to think not about sick care, but self-care. That will be an interesting conversation for another conversation. But I wanted to switch over to Nicki because, universal health services is a big enterprise. I mean, you've got hospitals, you've got ambulatory care centers, you're obviously involved in population health management if you have both. So in the middle is behavioral health. I'd be curious, I think our attendees would be very curious in knowing, are you seeing an uptick in that middle piece of the business in terms of behavioral health right now in comparison to a year ago? Do your data show anything similar to what Susan might be suggesting?
I think what has happened, at least from my vantage point, is that the behavioral health issues have been revealed. I'm not sure it's changed much. I think it's disarmed people from seeing, feeling like we're immune, right? Like there's a vulnerability that has allowed for things to unfold or to come to surface or emerge, I would say. And I think, I've never bought the stigma. I always think, there's no difference. Every one of us, right? We're all human beings at the end of the day who struggle, whatever that struggle looks like. But what I think we've seen this past year is that because of what COVID has done, it has brought to life for many people our humanity. And so while I wouldn't say that, the inpatient side of the business necessarily looks that much different, I would say that it's opened and it has now created a fertile ground for those bridges or the conduits across the care continuum. That's really what I think, so that those that perhaps never thought about the behavioral health context, or those that were too ashamed, or like you said, the permission piece, right? That freedom part. Now we're going, okay, now how do we meet the need of the time today, which requires tools and platforms and solutions that actually thread through an end-to-end solution.
Thank you. Thank you. Noah, I want to ask each of you one last question. And, I think this is going to be all of your insights, all of your answers have been extraordinary. I want to thank you. It is really a privilege for us to be with the three of you today. And again, I want to thank Levi Shapiro for organizing this. This is such an important conversation, often underrepresented in the conversation when we're dealing with health and wellness in general. But I want to ask you, it's a combination of public health and business question that converges. And I want to start again with Megan, and here is the question I have. You've presented some excellent insights of what you're up to. I'd like you to venture to be a little bit predictive right now, if you would, and talk about 6 months from now in the area of mental health, whether it's mental health innovation, mental health services, or mental health policy. What do you feel must happen, and how will that impact people who are committed to innovating within the sector? I mean, Megan, you're kind of charged as counselors of industry. Rock Health is really charged with not only looking at what is, but trying to point at the arrow to what will be. What's on your horizon for 6 months to a year from now?
I think we're excited to see, in the context of mental health, but also more broadly digital health, this evolution from traditional video telemedicine to a more integrated virtual care model. I think COVID flipped a switch where a lot of patients and providers got exposure to the first time of what does it feel like to do a Zoom office visit with a provider. But the reality is that it's great that we can have that accessibility and safety, but that's still an episodic and relatively costly way of doing this sort of work. And it doesn't really create scalability when you're still doing this synchronous one-on-one visit. I think we're really excited for virtual care models, again, in the mental health and other clinical spaces that are going to combine the best of remote patient monitoring with data science to make sense of that information and flag it for providers, to integrate telemedicine where it makes sense. It might be a synchronous video visit, it might be an asynchronous text message, or as Nicki said, like integrating health coaches and other types of providers into that interaction, but having something that feels more continuous, something that the patient really trusts and is integrated into their life, as opposed to saying like, oh, something's wrong. Now is the time for me to connect with somebody, when there may have been some symptoms, some issues that could have been addressed more proactively if they were in a more integrated chronic care management model. So really excited for those kind of up and coming companies to continue to be funded and to get more traction among consumers, as well as among the self-insured employers, the health plans, the health systems that are going to be recommending and leveraging those tools for their patients.
You're talking about disruption in the whole mental health system to some extent. So we're going to be on the lookout for that. Susan, you are really at the point, as I mentioned earlier, where you and Prudential Life Assurance have to look at the trends and monetize that to make it happen. Obviously, without reimbursement, without a system in place, something falls between the cracks. What's your sort of vision for the next 6 months to a year?
I think the vision for us is about building out the ecosystem. It's about bringing more players together and then using data science, as Megan has said, to be able to understand what it is that's happening and to be able to bring personalized solutions to somebody at the point when they really need it. And that personalized solution might be a nudge to join a community, to engage in a conversation. Maybe it's to dance, maybe it's to sing, maybe it's to say what they're grateful for, or maybe it's to engage in a conversation with a therapist. But the individual has to drive what that action is. But we will utilize data to be able to help nudge them towards that and make the right intervention at the right time.
Thank you very much. And Nicki, Dr. Tessler, I want to ask you that question, but with a bit of a twist. And I hope you don't mind, since you also add not only your role as like Susan and Megan as an executive in the health sector, but also as a practitioner, as a PsyD. So I want to ask you a two-part question. I hope you won't mind. One is something we've skirted around, which is serious and chronic mental health issues, schizophrenia, chronic depression, people who are manic depressive. I value also your perspectives on how will the system innovate to engage these people, because obviously adherence to medication in those cases becomes a very important part of their health management. So I'd be curious not only to hear your perspectives of 6 months to a year, but if you could weave in also a few thoughts about how does the system better address the needs of people with chronic and serious mental health illness.
So it is a very neglected area. Let me just validate in innovation, the seriously mentally ill. As you know, the payer mix is not what you see with other populations. And so that alone can, somebody that's mired in finances might keep them from looking or analyzing it. They're also very complicated. Behavioral health is intricate and it's nuanced. It is gray. It is not black and white. So you tell me how to get precision medicine or even to just use genetic testing, not going to happen. So what will help with SMI population is measurement-based care. We've got to get better at measuring so that we can be guided and informed about how to work through more complicated and complex behavioral health. Things that are static, questionnaires that are used, those are not going to cut it. When you look in the future, you need to understand phenomenological constructs and dimensions to things like depression, to things like psychosis. It will not work to see these things as just variables. So genetic testing alone won't cut it. The PHQ-9s and all these static measures that are used are not going to cut it. We really need, that's probably why you hear me a lot talk about we've got to understand it. These are wickedly hard problems, but they're worth solving. I think the second point to make is around cost. Whenever I'm dealing with people, I'm fighting them typically on their principles, not my own. And so from a financial perspective, it behooves everybody to figure out ways to do crisis management better and crisis services better for the SMI populations, to look at things that expand from care, clinical care, to social support, to employment, to patient empowerment strategies. Like you said, long-term injectables and all these other interventions that need to be at the forefront. And so even from a cost perspective, if you looked at one of the costliest chronic conditions, obviously SMI is there. So whenever people start talking to me about finances, which, I straddle, as you know, business and clinical, I will be very quick to say that our way out still, whether I'm talking clinical or business, is through the quality of care and how we really go after understanding what we need to do. And so as I look to 6 months from now or a year from now, I plant the flag at providers like myself being more agile, right? There will always be patients that need inpatient, always. That's not going to change, but that's not the only answer. That's one way. There are all these other customized, personalized pathways that we have to go after. Because when I talk about humanizing, that, digital health is hand in hand with that. You're on mute.
That was a magnificent addition to what Susan and Megan just added. This is one of those sessions where to really value the conversation and the contributions of our panelists, I would recommend people listen to the recording again, look over the presentations again. The depth of our panelists was extraordinary. Their knowledge of the field went from 30,000 feet to 3 feet, back and forth. And it is a rare opportunity where we have this chance to listen to people who are very dedicated to the patient's well-being, and understanding that the system must bend to the patient, not the patient to the system. You are really role models for us. I want to thank you on the behalf of our attendees today. To all that will hear this recording, I want to wrap up by thanking our host, Levi Shapiro. Levi, as I said earlier, is an ambassador, certainly an ambassador for the patient community, but an understanding of how innovation can improve the human condition. So Levi, I know that you're on mute right now and you're welcome to take yourself off, but I want to acknowledge you for making this happen. I'll just add that Levi right now and his family are on vacation. And he has a dog, I think by this point, a 9-year-old, and his wife, who's an academic, sort of running around in this little apartment that he's rented, and he's hosting us at the same time globally. So Levi, we want to thank you as well for making this a priority. Megan, Susan, Nicki, thank you again. To our attendees, thank you. This will be available as a recording. Levi will be posting it on the various mHealth Israel sites, and I encourage everybody listening to grab that and share that as well. Thank you. Wishing everyone a healthy and well day. Bye now.
Thank you so much.
Thank you.
Thank you.
Thank you.